What pain relief can you have after a caesarean birth or a vaginal birth which is safe for breastfeeding? As a standard, anything that is prescribed in a postnatal ward should be safe for breastfeeding. And the Breastfeeding Network is a fantastic resource if you are planning on breastfeeding or already breastfeeding and are prescribed any medications at any stage. It will give you the complete lowdown you need to know about those medications and how it passes through the breast milk if they do at all. The first medication that is often prescribed in that immediate postnatal period and administered is something called diclofenac suppository. It goes up the bottom and it provides about 12 to 18 hours of really good anti-inflammatory pain relief. It's great because it doesn't make you sick or feel sick or nauseous and is usually used after a caesarean birth, after a vaginal birth when stitches have happened, or when there's severe after pains. Then the next medications that are good to take with breastfeeding are paracetamol and ibuprofen. Now, in some units across the UK, they recommend an increased dosage of ibuprofen, so this is worth a conversation with your healthcare provider. Some of the units don't recommend 400 milligrams 3 times a day, but recommend it 4 times a day. Now, this does depend on your individual risk factors, your own medical history. For example, people with asthma, postpartum hemorrhage, any concerns with kidney function, preeclampsia will not be recommended to have either ibuprofen or diclofenac. And those who have got cautions will also need a review as to whether they take it 3 or 4 times a day. So this is worth an individualised conversation between you and your obstetrician as to what you can or can't take in that postnatal period. There also needs to be a gap between the diclofenac suppository and then taking ibuprofen for the first time. So have a conversation with your own healthcare provider as to what that gap is and also when you can take that next. And then we move on to the opiate medications. Now, opiate medications can cause your stools, so your poo, to be quite solid and potentially increase the chance of constipation in the postnatal period. So if you're having either of these 2 medications next, it's worth asking for something called a laxative, which is a poo softener. Dihydrocodeine is one of the most common forms of pain relief that women are prescribed, administered in the hospital, and given some medication to take home with as well. Dihydrocodeine works best if you can take it alongside your paracetamol tablets. There is some evidence that highlights that by taking the dihydrocodeine at the same time as the paracetamol helps it absorb better within the system. Now, I'm saying dihydrocodeine because codeine, so the codeine that you can get sometimes over the counter, is not suitable for when you are breastfeeding, and that's because of the way that it is processed within the breast milk. So dihydrocodeine is safe to take, codeine is not. And the final medication which is prescribed, and that is oral morphine. This can be given every 1 to 2 hours depending on the dosage and the frequency that is prescribed on your drug chart. Again, it's an opioid medication, so it should be prescribed alongside a stool softener, a laxative medication to help reduce the chance of constipation. Other side effects include drowsiness and tiredness. Bed sharing is not recommended whilst there are opioid medications within the system, such as dihydrocodeine or oral morph. And there are some women and people who are allergic to opioid medications as well to be aware of. So all of this is based on an individual prescription basis. Finally, there are 2 other methods that can help to reduce the amount of pain relief that women and people may request in the postnatal period. That is music during theatre during a caesarean birth. It's been shown to lower the amount of morphine that a woman or person may need. And that's partly because it boosts the endorphins at that stage. The final one is a TENS machine. So this can really complement your pharmaceutical pain relief. This can help with things like after pains in that postnatal period, helping you get out of bed. And TENS machines were first invented to help with surgical pain relief.